Yeah, so I see all the people, and yeah, if you can't see the chat, I can see the chat, but I can't set it up any differently. So maybe you should turn yourself back into the host. And looks like,
You have to give it to me though.
oh, right. Forgive us. Panelists. Make host. Okay.
Oh, she disabled the chat. Good, just go for it.
Okay. All right. So we must be able to ask questions then. It looks like the Q&A is engaged and they've been telling us they can hear us. Chat is disabled. Okay. Great. Thank you so much. All right. Well, we're just going to get started. We're already recording. And Shantae, I'm happy to introduce myself.
Go.
And in the meantime, you can help me get the little polling questions ready to go.
Okay.
So my name is Cecily Peoples Rodriguez. I am the Associate Director for Research and Organization Innovation at the Institute for Policy and Governance at Virginia Tech. In Blacksburg, Virginia. I actually am housed in a smaller unit of Virginia Tech in our Richmond, Virginia campus. I am also honored to be the chair of the certification board for the Institute for Diversity Certification, and am also honored to be one of the reviewers of the CDE CDP projects. And so I have been involved with IDC for quite a while and am happy to be here. A couple other things by way of introduction. I've spent the better half of 25 years working in migrant and immigrant refugee communities, particularly in the public sector, in local, state, and federal government. And I have a particular interest in kind of understanding how people navigate our American service systems when English is not their first language. So that is kind of what we're talking about today. We only have an hour, so as I was thinking about all the things we could share on this topic, I pulled together a couple of things that I've been sort of playing around with, trying to connect together. I'm here with a friend and colleague, Shantae McKinney, who is helping out with the practical technology, I guess. And I bet a lot of you know her already as a IDC Society for Diversity staff. Anything I'm missing, Shantae, before we move on?
Nope, I think you did really well.
Okay, great.
Welcome. Thank you for sharing your wealth of knowledge, because I know this is something that's close to your heart.
Yes, it is. Thank you so much. Okay, so if you wouldn't mind, in order to kind of get a sense of how best to spend this hour, I'd love to hear a little bit from you all and where your backgrounds lie. So Shantae has a couple of polls that she's going to pull up for me. I think they're separate polls, so if you just want to, there are three of them, but I'd like to do them all in the same um, in the same moment. So if you could, do you all see the poll? I'm assuming you do. If you could just answer those questions, or what industry do you work in? And Shantae, if you see the responses coming in, you can let us know.
We're waiting for two more responses. Okay, well, we can answer those. We have 30% are in business, 30% in healthcare, 2% in government, and 18% is other.
Great. Okay, thank you. I'm assuming that might be that you all are consultants as well and sort of work across a lot of different industries. Shante, would you put the other poll up? The second
Okay,
one?
I will.
Thank you.
Here we go.
So do you have any experience planning or providing language access services?
All right. So we have 20% says a lot, 10% is some, 20% a little, 50% says none.
Okay, great. All right, so that's a big mix of folks. So those of you, I know we don't have the chat enabled, but if you want to put your comments or thoughts in the Q&A, please feel free. And I'm going to ask Shantae to chime in as people say things that are relevant and sort of provide input, and she'll chime in as we go through this hour. The third poll is a question related to, what are some of your challenges in providing or thinking about language services, if you have any experience in that. And not everybody will answer this, but just trying to get a sense.
Yeah, just the 1%. So, oh, okay. We got people answering. Okay.
Great.
Yeah.
And then I can't see them, so I guess once you publish them, we could sort of see them all together.
Okay. They're coming in now.
Okay.
Well, we got 8 out of 13 so far.
Let's publish those, and people can continue to answer if they like, and we'll have them on the back end.
Okay. Want to share the results? Okay, can you see the results?
I can't. Can
Yeah,
you maybe read a couple out loud?
I definitely cannot.
Okay, all right. Well, we gave it the old college try. Okay, so if you feel like putting some of your challenges in the Q&A, that's helpful. I do have like challenges doing two things at once, so I'll look at them as we're able. Okay, so I'm going to share my slides and we can get going. Confirming that you can see my presentation, Shante.
Confirmed.
Okay, great. Thanks. Okay, so again, like I said, I'm playing around with some of the elements and these concepts and themes myself. So you guys are kind of helping me practice these ideas that I have and how they might be connected. Again, I spent a lot of time as a language access manager at a large state publicly funded agency. I'm a bilingual behavioral health staff interpreter. I have a 40-hour credential for building bridges as an interpreter, and I've spent again most of my public life in professional life in working in and around this language service issue. I'm also a public administrator graduate, and so those topics are really interesting to me, and that's kind of where I'm pulling my information, both experience and my studies. So what we're going to talk about today are kind of three main chunks of that I've sort of kind of organized my thoughts. So some of these relevant concepts that I'm arguing are connected to language-based inequities. And then a little discussion on the impacted populations as I see them, and how some of the research discusses them and how they are impacted by language-based inequities. And then if we have a little time, I'm going to talk about some of the elements of language access services. It sounds like we're kind of half and half familiar with what these might be. So if those of you who have a lot of experience in language access, please feel free to put your comments into the Q&A as well.
I did enable the chat, so
Oh,
if you wanted
nice.
to, hopefully you can see them. See
I
if
can open
everything.
it, but I can't read it and talk at the same time. I'll start
I
to
can do
stumble.
that. Yeah,
Okay,
yeah, yeah. The
okay,
chat has been enabled, so I can read
fabulous.
them for you. You just tell me when you want me, because there were some questions that came up. Do you want me to
Okay.
read the questions that came up already previously?
Let's try to hold off
Okay,
until the closer to the end. I'll really try to hold a 15-minute period at
got
the
it.
end. And honestly, I don't have anything happening after 2, and I'm perfectly happy to stay around. But most of you know this is a really complex and big topic that just can't be addressed in an hour, and all of the nuances can't be discussed or mentioned. So it's been a challenge to kind of pull this together, but I'll do my best. So the level at which you read, write, and speak American formal English is related to a concept out of public administration called administrative burden. It is also obviously, to many of you in healthcare, understand that it's a social determinant of health, and related to that as well as sort of it explains some of the of how we look at it. It's an element of this causal chain that I'm going to introduce as well. Um, so let me make sure I'm in the right place. Yeah. So this idea of administrative burden is not super well known outside of the public administration scholarship, but it's a really meaningful concept in that it describes or it examines the way in which regulations and bureaucratic processes, policies, and just the day-to-day ugh of having to get paperwork and applications and insurance forms and all that stuff done, and how people are challenged by that process. We talk about it in public administration in 2 ways: that the cost to the organization for administrative burdens and the cost to individuals. I'm not going to read this. By the way, I'll share these slides with anybody who would like. You can just email me at the end, and I'm happy to share them. But this is a little bit more information about administrative burden. When I talk about this, we're not just talking about healthcare, right? But we're talking about applying to community college. What's the burden related to paperwork, to the interaction between public service providers and the individuals seeking to access services, and all of the ways that these negative impacts or burdens can keep people from getting the services that they are constitutionally honestly eligible for. Another concept or theory that is relevant to language-based injustice is the social determinants of health. And of course, these are more well understood with the idea that we know place matters, right? Where we live, where we grew up, what our access is to food and healthcare, what our access to open spaces are, etc., all impact how we are healthy and well and able to live our lives in our communities. And additionally, most social determinants of health are also very much shaped by how we distribute money, power, and resources. And of course, those are dependent on policy choices. So again, these are things that we could be addressing if we if we sort of considered how we distribute these elements, money, power, and resources. Another concept that I think is really relevant to language-based injustice is that idea of the causal chain. So again, this is an example or of how this works. But obviously, Jason is not in the hospital because of a simple bad infection, right? There's all these domino effects or reasons why Jason ended up in the hospital, and a lot of them are based on social determinants of health. They could be related to administrative burden, whether someone was able to get their Medicaid in time or showed back up at the DSS to complete or follow up with pay stubs, etc. So and all of those things could be impacted also by the way in which a person speaks kind of our standard English. And so there's a significant difference, obviously, between how we think about language services or language access in the private sector and how we think about language access in the public sector. And of course, most of the time, this is a generalization, but most of the time in the public sector, we're thinking about making things accessible linguistically because we are interested in generating revenue, right? Businesses often kind of lead the way in these accessible things because that's their purpose, is to earn money. And if you can access more people, you can often earn more money. Again, that's simplified, but that's kind of a generalized understanding. In the public sector, there are a couple of other elements that require us to think about language-based inequities or language justice. And some of that has to do with the law, the federal regulations related to how public entities are expected to deliver services to the individuals in our country. One of the one of the primary laws around language access is the Civil Rights Act of 1964. In the early 70s, there was kind of a landmark case that set out a connection between the languages spoken of individuals and national origin. And so since the 1970s, we've considered the inability to receive services in the languages that you speak is a violation of the Civil Rights Act based on national origin. There's the point of the Civil Rights Act as it relates to national origin is really focused on this idea of meaningful access. And so public organizations who receive money from federal governments, state governments, local governments are all obligated to address this idea of meaningful access for people who do not speak English in their organizations, based on kind of these four factors. So organizations are responsible for deciding what this should look like themselves based on these factors, but it has to kind of whittle down to this idea that organizations are providing this meaningful access. Another element of the law that makes this a public sector issue is the Americans with Disabilities Act. This is another act that requires communication needs be addressed in federally funded organizations or publicly funded organizations. And of course, this is related to individuals who have communication needs based on some disability, identified disability. The kind of the difference between these two, which is pretty important if you're thinking about language access services, is that meaningful access is something that is often determined by the organization itself, not by the individual, right? So the organization is developing what that means, and the individual is simply receiving whatever has been defined as meaningful access by the organization. ADA, on the other hand, if you look at the bottom bullet here, is a little more explicit, and they argue that organizations receiving public dollars must give primary consideration to individuals' preference. So if a person is requesting, let's say, cart services like electronic, or auxiliary aids that are like note takers or computer aided transcription services or the like, the organization by law must make those considerations first. And this is not to say that we also in the United States, one of our core values is sort of equal services, equitable or equal access, things like that. And so this is another kind of concept around the reason it's so important in the public sector is that this is how we like to see ourselves, that people have all the same opportunities to kind of be successful, healthy, and well. So there are areas of the country that are starting to talk about this in ways defined as language justice. And this has really been interesting to me, and I've been enjoying exploring this a little more. And, it's not just about, your ability to get a service or to have a healthcare encounter that you understand, but it's about thinking about language and the process of communication as an organizing tool and an expectation, right, that helps people have more meaningful impacts in their civil society. So this is sort of where this presentation kind of came from, and this idea that, instead of just focusing on language access services or thinking about services in my nonprofit organization or my healthcare. I mean, what does it mean to be fully engaged in our society if you don't speak standard American English? And what we do know, from a lot of different research is that linguistic inequities show up in the United States when an individual has low literacy, when they have low health literacy, when people are considered neurodivergent, if you're deaf, blind, hearing impaired, or have other sort of physical communication needs that would keep you from speaking standard American English. Also, if you're an individual who would typically speak using kind of a stigmatized variety of English. So we talk about African American English or Chicano English or Appalachian English, these dialects rather that have some stigma attached to them. And then also, of course, which is where a lot of this discussion will lie, is in folks who are non-native speakers of English. So they are English language learners or limited English proficient. And we'll talk through a little bit of each of these just to kind of explore what they all kind of mean. So I think anybody who's not living under a rock probably understands that literacy in the US is a concern, and it's been a growing concern, right? So this is some statistics from the National Literacy Center statistics. And these are quite alarming to me. Almost a quarter of adults in the US are illiterate in 2022. More than half of US adults read or have literacy below a sixth grade level. 45 million of us are functionally illiterate, which I'm going to botch like the formal definition, but this is the inability to fully understand fully read and write in American Standardized English. So, it pretty much it goes without having to make a lot of more explanation, is that people who cannot read and write in this American Standardized English are going to have a lot of challenges navigating our public service system, right? Another community is related to health literacy. So you can be an individual who's fairly literate, but when you let's say you have a health crisis, or you become ill with a chronic disease, some of those things can impact how you understand and make sense of language, as well as how you might be able to make your own decisions related to your health care. I think this statistic here, 60% of patients did not understand a standard informed consent form. That's a pretty alarming figure, and I failed to put the citation here, but I will on any of the slides I send you guys, because this was a study. This was probably 10 years ago too. It was a university hospital system. But this is, people are signing surgical forms and, making health decisions that could impact their whole life, and they're not understanding these consent forms. So certainly that's a language justice issue. Additionally, there are other types of literacy, right? And as we move into kind of this modern world, folks who work closely in human services or public services are probably observing this, that we have a lot of ways in which we are expected to be literate in this country, in order to be successful and contributing members of society, right? And those include things like media literacy, the idea that we understand where and how our information is coming from, what to believe, what to be skeptical of, sort of how we understand what's true and what's not true. Civic literacy is the idea of, how do we know how to participate in our civic life, right? Including understanding government processes, staying informed, exercising our voting rights and obligations. Of course, financial literacy is another big part of being healthy and well in this country, and language can impact that as well. That's, of course, your ability to understand and use financial skills to make informed decisions about your money. Technology skills, being able to open up those QR codes and sign up for your health care, or for your emergency notifications from your county government, right? How well are we able to navigate computers and all of the other things that are just exploding for us, and the expectation that we use them and we know how to use them and can read them. Of course, digital literacy, same sort of thing, being able to navigate websites, use search engines, communicate through social media, all of these things that many of us who read and write in English take for granted as a part of our regular daily operating. And then critical literacy, sort of that ability to understand information, and understand, the intersections between kind of language and power, making decisions for yourself, self-determination, and that kind of thing. I'm going to stop for just a second and run through the chat. Yeah, please keep putting in your comments and thoughts, even if we don't recognize them all. We all learn from your comments there in the Q&A in the chat.
So Cecily, do you want me to read the initial ones from the Q&A?
Sure.
Okay, so I'll go to those first, and then we'll go through the chat.
Okay.
The first one was from Audretta, who says, her challenges, the challenges were cost and assessing the demand for the services. Um, Melody says, I have not considered the language access services as one of our verticals. An anonymous person said the cost of translation
Yeah.
services and availability or access of ASL interpreters. And that person works with individuals with ID and DD. And
Mhm.
then Pamela says the challenges faced are the different dialects within a culture that may vary by
Yeah.
pronunciation and could mean different things. I
Yeah.
work in healthcare, and it is critical that information be shared for understanding and follow through post discharge.
Yeah. Yeah, very much so. And so in public administration, we call these things wicked problems, which is just what it sounds like. It's just a complicated problem, right? That can't be solved by one policy decision, but it needs to have multiple sort of inputs in order to solve it. And they're real problems, and I think one of the things that happens is we sort of demonize organizations that are really trying to do their level best to address language issues, but we simplify how complex it can be. And I work with mental health agencies all over the state of Virginia, and see these in practice all the time. IDD in particular. In one mental health agency I was working at, just kind of consulting on language access, they had a person who was in kind of a day treatment program for behavioral health recovery, and they didn't speak English. And so, with the good intentions, they thought, okay, well, we need to have an interpreter here for this individual. But the individual came into the setting every day from like 9 to 5, right? And then there were many times when they didn't want to talk or they didn't want to use the interpreter, and so the interpreter ended up kind of sitting around getting paid, and nobody's happy with that, right? And so this is just sort of an example of how complex it can be, to really provide meaningful access with limited resources. And people do claim it's an unfunded mandate that we are expected or required to do this, but resources do have to come from somewhere. So I don't pretend to think this is a simple thing to address.
Do you want me to read the remainder? I think it's section
Let's
one.
um let's
Hold
walk
off.
through, yeah, let's walk through the rest, and then we'll make some times for questions at the end and
Okay.
comments. All right, so connected to the individual who talked about IDDD settings, those are intellectual disability and developmental disability settings. Language for individuals who are neurodiverse or who have some diagnosed um, intellectual or developmental disability can be very challenging as well, even though folks may speak English. I have my own son is on the spectrum somewhere, and those of you who know what I mean know what I mean. And he also has learning disabilities and some other sort of behavioral stuff. But he's a grown man now, and people are not very patient with him as he seeks to sort of process information in his daily life, in the bank, on the telephone with his cell phone company, on with the insurance company, or making an appointment for a doctor. If people aren't processing information in a way that we think is appropriate in your regular work, we often don't provide them. We get frustrated, right? It's just natural to get frustrated. We're busy, we've got things to do, and we need to move on. So we sometimes don't give people what they need to make those decisions if they're not processing things the same way we would be. And this kind of shows up in sort of the obvious ways, right? People with cognitive disabilities may not process forms. They may read at a low literacy level. It's common. So forms, legal documents, signing things can often be challenging and can put people at risk and result in kind of inequitable outcomes for folks. Another community we mentioned earlier is this idea of these dialect prejudices, dialect discriminations. And, some of the ways that this shows up for people might be in the perceptions of, let's say, a teacher in a school who's teaching English grammar and a child who speaks a non-standard dialect at home. And all of the ways in which our interpersonal relations and assumptions and stereotypes might pop up for that kid, and how a teacher might engage with them on, oh, you speak bad or you speak good or don't say that, those kinds of things. And that impacts the kid's relationship with the teacher. A study out of University of Pennsylvania recently looked at how potential tenants who spoke kind of the African American vernacular English were more likely to have housing applications rejected. Non-native speakers experience stigma and may have that may impact their ability to do business, let's say. So an example would be someone who English is their second, third, or fourth language. They have a heavy accent. They go into the county business license office and they want to get a license for their business. And with a heavy accent, the individual is not understanding them. There's a lot of paperwork in English with acronyms, etc. And all of these things just kind of build and doesn't get the same opportunity to have their business be licensed, which then impacts the individual's ability to comply with the local law, right? And so that's that domino effect again. And then, and one example of what that looks like in real life is this really kind of telling and upsetting scenario from the George Zimmerman trial. I suspect everybody kind of knows what that is. This man who shot a boy actually at a gas station in Florida quite some time ago, 10 years, I guess. So this scenario is Rachel Gentile served as a witness in the trial of George Zimmerman, who was tried and acquitted for the shooting death of Trayvon Martin. A researcher studied this interaction and had asked a lot of jurors about why they decided what they did. And as you can see here, basically one of these jurors mentioned in her post-trial interview with Anderson Cooper that because of her education and communication skills, she didn't think that Ms. Gentile was a good witness. She found her hard to understand and not credible. In the earlier information, Gentile did speak sort of a stigmatized African American vernacular, and thus the jurors assumed that she was not trustworthy. And this is not an uncommon thing. I suspect you all are nodding your heads, thinking, yeah, that sounds about right. And so the last community we'll kind of talk about as it relates to language inequities is the group of people we call limited English proficient. This is like nerdy knowledge, but the reason you'll see LEP in one sector of government and you'll see ELL in another sector of government, and that's simply because of the way the federal law defines a term for somebody who doesn't speak English proficiently. And so in the healthcare settings, sort of the health and human service settings, the law defines it as limited English proficient. On the education side of things, it shows up as English language learner. English language learner, of course, is a little bit of a more strength-based word for that, because we know that people do eventually learn languages over time. And we also know that English may not be their second language. English may be their fifth, sixth, or eighth language learned, right? So there's some stigma attached to how important English is even in our own communities. And so what does language access mean? If I've been talking about the law that says we have to provide language access, kind of a snarky way of how I describe it is that if people are like, basically, I'll back up. Language access does not mean that everybody gets the exact kind of communication opportunity or service that they want all the time, 24/7. It means that you have, if you don't speak a standardized English, you have the same exact opportunities in a service delivery setting that somebody who has standard English speaking and writing and reading would get. So, in my snarky way, I say, if your organization provides fantastic services to the English speaking population, then your obligation is to provide those fantastic services to the limited English proficient populations. If your organization provides crappy services to the English speaking population, then technically you're obligated to provide those same crappy services to the limited English population. So it isn't some sort of extra special thing that people who speak another language get. You're really just obligated under the law and sort of to provide that same service or opportunity that you would give somebody who does speak English. And I would argue that a lot of us know this, right? Like, we know that these are important for people to get the services that we're offering. We know that outcomes are improved if communication is enhanced, all of these things we kind of know, but our problem is we don't often implement it in a strategic or intentional way. And so a lot of the things that we end up doing are only sort of quasi helpful. One of the big things we do is we use employees who may claim to speak a language or who have used a foreign language, and then now they're using it in their scope of work. And that's what this little meme on the left-hand side is that, between her, it's got a typo, between her broken English and my broken Spanish, we got by. And I can't tell you how many times I've heard this. And this is really upsetting, because this means that we have this tacit agreement that we don't have to ensure high quality services for that person. The irony is we spend all of this money, we invest in credentials for our doctors, nurses, bookkeepers, project management professionals. We make sure people have continuing education units, and that they're highly trained and highly qualified. And then when they need it, they turn all of that highly qualified information over to an individual who often we don't even know speak the language fluently, right? And so it's a disconnect between how we say we want to deliver a service, or we ensure people are highly trained, and how we actually use those highly trained skills. And so this slide here is kind of about interpreting, about how we don't do a good job typically of addressing interpreter quality. Maybe we hire vendors who teach, pardon me, who do our interpreter services, but we don't necessarily know that they've been trained, or maybe we have a specific vocabulary, like in behavioral health, for example, and we use a lot of specific vocabulary, but we don't know if our interpreters truly understand that specific vocabulary either. So we just sort of let things go. Once we've handed it over to the language person, we forget about kind of ensuring that quality often. Not everybody, of course, but I'm just saying in a lot of my experience, that's been the case. And one of the problems here is that we just make this assumption that people know. If you speak another language, you just you know how to be an interpreter. And actually, interpreting is a skill set that people learn over time by practice. It's a practice-based profession, and you get better at it as you've had this opportunity to do it. But we forget that people who maybe learned a language in their home may not have the vocabulary they need in a professional setting to actually truly work as interpreters. So we use things like Google. We sort of make do, right? And that kind of thing. Another element that is often a challenge in language services is translation. And, so translation, or another way to consider that is transcreation. So translation is also a skill set. Not everybody who speaks another language should be assumed to be a translator. If you've learned a language, outside of a formal educational setting, you probably don't have the grammar that you would need to translate something. If your your other language besides English is your second language, often you haven't learned that grammar either. So organizations really need to think about who is doing their translation, and is translation, which is just kind of word for word exchange of a language, or transcreation, which is the idea that you are taking the meaning of a document and you're recreating it in another language. What are the needs of the particular thing that you're translating? And this really gets complicated in practice, right? Because, for example, I was working with one of our mental health hospitals years ago on translating a bunch of documents, and they still had a lot of paper-based documents. And so we got to the discharge form and we thought, okay, easy peasy, we'll put this all in, in the other language. But then on the form, of course, there's a place where a nurse or a discharge person would write out some specific instructions. And so that created the problem of, okay, well, in that space, right, who's going to translate that if it's not translated on the form, because the discharge person doesn't speak the language? And so it's not just, okay, let's plug this in somewhere and get the document. It's really thinking through what do we need translated, and how is it going to be implemented over time? What else do I want to say about that? The other element there is that one of the ways that some of the folks I've worked with have really gotten in trouble in with regards to the law has been around consent forms and things like that, where people are signing English consent forms and not being able to read English, right? So those are really, judges and courts really do understand that the hypocrisy kind of that. You can't expect that people are understanding it if it's not in the language that they speak. And then the other element before we kind of wrap up and try to answer questions is around machine translation. So this little this little example here I like to use because it's of my own kid. She is now a teenager, 17. But in the old days, my niece used to watch her babysit her. And so on Facebook, classically, you know, I post this picture of my baby, and my niece who watched her wrote in Spanish. I mean, and those of you who read Spanish can see it's kind of a slangy sort of Spanish. And my sister, who is not a Spanish speaker, was interested in what Juana said, so she plugged it into Google Translate. And if you can see, the Google translation says, Nani already very grande is no longer the BBK wiped and bathed and gave him soup in your mouth. How I remember that strange. Wing before I cuidaba, before sorry time flies. And my sister Kate, of course, after giggling, says, I get the gist. But the point is we don't want to give people just the gist, right? People need to understand um, uh, communication in a way that they can make their own decisions, not just sort of this half-baked communication for people. What my niece actually said was that she is so big and she's no longer the baby that I bathed and spoon-fed noodles. Oh, how I remember that. I miss the Natalie from before, the baby I took care of. So you can see how they're similar, but they're really not the exact meaning. Okay, so the ways in which an organization can be linguistically competent may or may not be sort of obvious now after kind of talking through this, but you know, these are fairly simple things to do, but they just require some intention, right? So make sure you have those TTY or assistive technology devices. Making sure your contractors, your vendors, and your grantees are all budgeting for providing language assistance, right? So in the public sector, we often grant money to other people, or we write contracts for vendors and we ask them for budgets, and they often haven't had language services budgeted. And so then when it's time to deliver those services, they say, oh, well, we don't have the money to do that. But that's because they haven't budgeted it into their budgets. Thinking about those alternative formats, large print, audio tapes, braille, etc. Making sure you're using qualified translation services and qualified interpreters for your work. Understanding, you know, how language selection happens, especially in kind of healthcare. What is it that you when do people decide to use their native languages in times of crisis? When do they select to use their second languages, and etc. And then putting policies in place regarding the use of all of these things. So I'd like to stop. I know we don't have a whole lot of time, but again, I'm happy to stay a little later, and I'm happy to share these slides as well. But yeah, I mean, Shante, if you've been able to look through the chat or the Q&A, the questions, I'm happy to answer anything or consider anything.
I will go, let me see some of the things we've talked about. Oh, Catherine says there's an interesting dynamic in my services around can or should we provide language access for our staff or just for our customers or clients. She worked with colleagues who have come from all around the world.
Mhm. Yeah.
Pamela said, yes, the healthcare study is about 10 years old, I guess one that you brought up, but remains an issue and has multiple standards of practice and guidelines set up to try and mitigate the misunderstanding of medications, procedures, etc. It is hard work, but necessary.
Yeah.
Melody and agreed that empathy and patience is required. Audretta says, this is really helping to broaden My understanding of language access, not just translation, but sensitivity, practice, and grace. Those interpersonal skills are not always included in performance expectations.
That's true. Yeah, that's a great
Uh,
point.
yep, Rochella said, I always practice empathy with individuals where language is not their first language. It may be frustrating for the person trying to understand, but imagine how frustrating it is for the person trying to communicate. Patience is needed. And then
Yeah.
Audretta says, please share the slides. Yes.
Yeah. Yeah. And you bring up a lot of good points, including like, I like to think of language access services as part of my quality assurance, quality improvement area. Because that is more organizational or like, systemic, right? Um, instead of just like a training element or a procurement element, it has there's more obligation to think about it in terms of performance, which is what someone said. Um, and that's kind of where I go with this very last slide is that, if you make this mission critical, again, as it becomes an embedded part of your organization, that communication, um, you're committed to effective communication for everyone, and that's an embedded part of your organizational mission and vision, then you can often raise awareness about it. And then you make sure you're including line items for language services in your annual budgets, just like you put in funding for the light bill or funding for somebody's credential continuing education units or something. It's a cost that you're going to have. You can't just wait for somebody to volunteer it. So make it a line item in your budget. And then, of course, train all your staff on the policy. So a lot of organizations, in fact, I'm doing a study right now of language access. It's a language access needs assessment for the behavioral health organizations in the Commonwealth of Virginia. And, what I'm finding is a lot of our behavioral health organizations have language policies or interpreter policies, but the staff don't know them. And so they're not implementing them. Also, interpreting can be tricky, especially in healthcare where people are trained in a dyadic relationship, building a relationship amongst two people. You add an interpreter into that mix, and then you've got a triadic relationship where the power is different, etc. Um, and yeah, and don't use anybody who's not been tested for the language as an interpreter of any kind. Um, so those are the things I can contribute, and if anyone would like to reach out and discuss this more or would like the slides, please let me know. I'm happy to learn from you as well.
I know usually Amber sends out the slides to the participants. So if you sent them, she will definitely send them with the
Okay.
recording as
Yeah,
well.
that's fine.
Mhm.
That's fine.
All right. Did anyone else want to really quick? Um, Pamela says, this has been fabulous. Great presentation, Cecily. I have to go to another meeting. Okay. Looking forward to the slides. Okay. All right.
Thank you,
That,
Shantae. I'll see you later.
you're welcome, everyone. Have a wonderful day. Thank you so much.
Thank you.